My name is Gasia, Mikaelian, and I'm coming to you from KTVU Fox 2 News, serving the San Francisco Bay Area. Today, we're talking about COVID-related stress, and specifically where the country seems to be headed. I'm so happy to welcome to this discussion mental health expert Margaret Cochran. Thanks for being with us.
Oh, thanks for having me.
Now, you and I have talked over the past year or so, and we've talked when things are getting better and looking good, and that brings a certain kind of emotion. But now it seems as infection rates are rising and a number of states are in real deep trouble with their COVID numbers, things can be seen as getting much worse. Why do we feel that sort of stress?
Well, we feel that sort of stress because our beautiful, large, crenellated brains go to its most primitive part when it's afraid. And when we're struck by something and we say, we don't know the answer, I feel like it's out of my control, that's when we begin to release cortisol, the stress hormone, and lots of adrenaline. And then we become what's called hypervigilant, where everything spooks us. What's that? What's that? What's next? What's next? What do we do? How am I going to handle this? And we begin to try to think of ways to control what we can't control, and then we're toast.
Because really, even though we can do our part by getting vaccinated or wearing a mask, I can't control what other people do.
No. And most importantly, what we have to recognize is what we do have control over. And that is how we respond to things. If we treat everything like, the world is ending, and it gets to the point when you get into that hypervigilance mode, a pot boils over, or the dog misbehaves, or some piece of mail doesn't get delivered, and it becomes this giant crisis when it's really not. It's just because you're overstimulated. So learning how to bring that back down, to be able to control the way that you respond, that is what you can really manage and change.
So even though I would like to sort of temper my response, how do you actually do that? I imagine deep breaths are part of this equation.
How do you know that? You're so clever. Yes, it's true. Deep breaths is, but there is a certain way to do it. And let's do it right now together. Just real quick. Okay. So this particular kind of breathing is called 4-7-8 breathing. We're going to inhale for 4. We're going to hold for a count of 7. And we're going to exhale for a count of 8. And while we're doing it, I'm going to talk to you. You don't have to say anything. Just say it inside your head. Here we go. Ready?
Yes.
Inhale for 4. I am enough. Hold for 7. I am enough. And exhale down for 8. I am enough.
That is about the slowest I've breathed in probably 2 years, but it does have, it has an effect.
It does. It absolutely does. It really begins to reverse that autonomic cycle. And it also reminds you, you are enough. You're going to get through this. You're going to find a way. You're going to find the path. And sometimes we get so wang-doodled, so wrapped up in what's going on, we forget our competence. We forget our bravery, forget our strength. And this little exercise helps bring us back to, I'm enough. I can do this.
Have you been hearing from a lot of your clients who say, I was feeling okay 2 months ago, but now I feel like I'm in that weird, dark place again?
Yes, I've been hearing that. And I've been hearing a lot of anger. Because of course, the situation that we're in is of our own creation. This charming little virus, and I use that facetiously with big air quotes, has been busy mutating and morphing, because if it can find a body that has no resistance to it, that gives us an opportunity to change. So because we have chunks of the population that have not been willing to get vaccinated, it gives a place for it to grow. And that makes all the rest of us, even though we've been vaccinated, susceptible to at least milder symptoms.
Well, I know there's a lot more to talk about this. I look forward to joining you again. Real quick, is there anything online our viewers can explore if they want to hear more from you?
Oh, of course. Go to my website, drcochran.com.
Got it. Margaret Cochran, thank you again for joining us today.